Welcome to this short training video based on the HEE assessment strategy, which is available on the website. This video provides a brief introduction to the Supervised Learning Event tool, the Mini Clinical Evaluation Exercise, shortened the Mini-CEX. The Mini-CEX enables the supervisor to assess a trainee's ability to identify, action and resolve issues effectively when providing pharmaceutical care to a patient. It also enables supervisors to review the skills, attitudes, knowledge and behaviours of the trainee. In the assessment strategy, the Mini-CEX is one of the assessment tools that can be used to record an assessment activity. The assessment strategy indicates which assessment activities can be recorded using an SLE. Supervised learning events such as the Mini-CEX are a formative assessment which aims to provide trainees and supervisors with the appropriate information to facilitate and enhance further development. They will also support the provision of evidence that will contribute to the demonstration of the learning outcomes. Mini-CEXs can be carried out in any patient care setting, such as the dispensary, a ward, consultation rooms in the pharmacy, general practice, care homes, or outpatient clinics. It can be used in a variety of scenarios, and there are a number of contribution to care interactions outlined in this slide where it can be commonly used. This list is not exhaustive, and other opportunities are available in practice. To maximise the developmental opportunities, it is important that the assessed scenario must involve a patient who is either new to the trainee or already known to the trainee, but a new therapy has been prescribed or there has been a significant change in clinical status. To ensure the scenario reflects everyday practice, it is vital that the trainee has not prepared for the task the Mini-CEX is to assess. However, if your trainee is lacking confidence or has never undertaken a Mini-CEX, it is acceptable for a mock Mini-CEX to be carried out away from a patient-facing setting. The Mini-CEX form is divided into two parts. The first contains a table of criteria which provides an overview on the different knowledge, skills and behaviours that may be observed during a suitable Mini-CEX encounter for the supervisor and trainee. Secondly, there's an area to document details about the scenario, the developmental feedback and action plan discussed after the SLE and trainee reflection. The Mini-CEX is criterion prompts to assist supervisors during the discussion with their trainees. The criteria of the Mini-CEX focuses on two areas. Firstly, the elements of delivery of patient care, and secondly, problem solving. There are 13 criterion within the Mini-CEX, and within each there are several skills, knowledge and behaviours that can be evaluated. For example, in medicine-specific issues, the supervisor may wish to review if the trainee successfully checked that the medication is prescribed correctly, considering the route, formulation, dose, frequency and course length, along with available patient results and observation and the effect they have on therapy. The trainee's ability to demonstrate all of the several skills, knowledge and behaviours within a specific competence varies on the individual stage of development within the training programme. For each criterion, the supervisor can choose to rate the trainee at below expectations, meets expectations, exceeds expectations, or not applicable. Meeting an expectation is based on professional experience and judgment, and so will be subjective to each supervisor. It is strongly recommended prior to undertaking any of the SLE tools that the supervisor sets out expectations with their trainees. For example, they may choose to set the expectation to the level of a day one registered pharmacist, or they may choose to set it at the experience of a trainee at the point in time of training. This will have an impact on the rating scale of the trainee, but should not impact on the action plan and developmental needs of a trainee. It is expected that in practice some scenarios will not provide opportunities for all criterion to be met. Therefore, the not applicable option should be used and should not impact the overall assessment of the trainee. Trainees and their supervisors should use the developmental model of feedback, which is designed to encourage trainee reflection. This is covered in the Introduction to Supervised Learning Events video. Please refer to this video for further guidance. Once the feedback has been discussed and the trainee has confirmed that they clearly understand it, the trainee and supervisor should form an action plan to capture future learning goals. This is covered in greater detail in the Introduction to Supervised Learning Events video. Please refer to this video for further guidance. This slide provides an overview of the Mini-CEX process and time required. Estimates of time will vary dependent on trainee supervisor confidence in using the Mini-CEX and the sector of practice and also the presenting scenarios. For further information on the SLE tools, please visit the HEE website. A more detailed e-learning module on pharmacy Mini-CEX is available on the e-learning for health. The link to the training is available in HEE Trainee Pharmacist Foundation Year Assessment Strategy available on the HEE website. For further information on the learning outcomes, please visit the HEE Trainee Pharmacist Foundation Year Assessment Guide and Strategy on the HEE website. This describes the assessment activities, which as a whole are designed to provide a range of evidence against each of the learning outcomes. There are also many other additional resources on the HEE website. For more information, particularly on the learning outcomes, please do look at the GPHC Foundation Training Manual on the GPHC website.